mental health at work today, and we're going to be doing a deep dive on practical tools for real situations, stuff that we have put together that I hope will be extremely useful to you in your roles. I'm Dr. Lara Shemtob, and obviously we're here as part of the Insight Workplace Health community, and I will tell you a bit more about myself now. So this is me. I'm a general practitioner and occupational health physician by background, but I also do a lot of work in research, policy, and teaching. And one of the things I absolutely love doing is blogging. So I've got my own blog, which is on a website called Substack. I write about something to do with work and health every week, whether it be the Harrods scandal or how AI is changing how we work. And you may have also seen that I also blog and produce videos for Insight Workplace Health. So I've been working with Chris, Liz, and the team for a long time now. And our focus for those blogs are really the nitty-gritty occupational health topics that we know are really difficult to troubleshoot in practice. So those are up on the Insight website, and we've also complemented them with some YouTube videos as well. But I'm much more interested to hear about you guys on the call, just to give a bit of context about the colleagues in the room with us today. So if you could go to menti.com and type in 23022856, we will, it will be brilliant to hear a little bit more about you. So here are some suggestions on things I'd like to find out about you. So you could tell me a bit about your role, your sector. So it could be like, I'm a HR officer, I work in manufacturing, the geographical region. So maybe I know many of you are based in Wales, and what you would like to get out of today. So I'm hearing engineering, ops, people looking for information, the HR specialists on the call. This is all really useful for context, because in these big events, it's so nice to kind of put faces to names a bit and hear a little bit more about who's around. We all have different expertise. There's going to be a lot of expertise in the room. So many colleagues here are based in Wales. People have legal backgrounds, engineering backgrounds. We've got managers, HR on the call here. It's great to see some of the more niche things going on, like fire service, people covering the whole of Wales, people looking for tools today. That's brilliant. We're definitely going to be departing with some tools. I'm loving these kind of bits and pieces of different industries, like waste and recycling. That sounds so interesting to me. Construction. I'm thinking some of these industries are dangerous. Some of these industries are higher risk than others, different risks, right? Brilliant. I'm just going to give it a couple more minutes just to get some more details. Youth workers, lovely. Team leaders, people. So youth worker, again, really interesting from an occupational health perspective. Fisheries trade. Okay, all this interesting stuff. Thank you very much. I will move on and we'll hold that context in mind as we go into our intro here. So it was great to hear a little bit about the kind of information, insights, expert advice and tools that you're looking for. I'm going to share a little bit about what we hear in practice from HR and managers around mental health at work. And these are just kind of quotes that may be familiar to you in your practice too. So people say things like, you know, I'm in HR, I'm not a therapist, but I'm expected to respond to all of this really challenging mental health stuff when people come forward, or they feel very stuck between employee well-being and business risk. How do they navigate that balance? Or they get into these conversations with colleagues trying to support them, but they're really aware that they could say the wrong thing and it feels quite difficult sometimes. But I'm also interested in your everyday dilemmas. So what kind of dilemmas do you experience at work? in practice with mental health? Like, are those three dilemmas familiar to you? Do you find that you have different issues around, for example, managing risk in the workplace? Do you have any issues around the language that should be used, confidentiality in the workplace with colleagues with mental health, knowing about what to do next for solutions? So yeah, we've got some interesting stuff coming up already. So this is it. This is so useful. So someone here said, supporting staff whilst trying to ensure business continuity, such a dilemma. That's the crux of occupational health. People seeing burnout, stress, burnouts popping up quite a lot, managers and feeling breakdown of trust, difficult, risky things here. We're talking about alcohol, we're talking about suicidal ideation. We'll be touching on some of these things today. Saying the wrong thing, triggers, knowing the right thing to say, personal stress. People expect us at HR to be therapists. We can offer support, but there's a limit. Childcare issues affecting mental health. So yeah, that kind of social dimension. Mental health and mental illness is often affected by our external circumstance, managing expectations and how they change. Work-related stress, overwork, challenges with occupational health guidance, not feeling supported. So yeah, this really demonstrates the complexity of the kind of stuff you're dealing with. And it's quite significant. This is significant and complex stuff. That's just part and parcel of HR and people operations roles now, and part of management. Thank you so much for your contributions here. So learning outcomes can be a bit boring, can't they? So I've tried to make them a bit more pragmatic here. We're going to be thinking about real, sticky, mental ill health situations at work. And our aim is to exit this webinar knowing what to do in the moment. So I'm going to introduce this tool that it's a kind of tool that we've developed, just a 3-step mental health framework, and it's going to be popping up in the case studies that we use today. Recognize, respond, refer, and manage. So just these 3 steps, I hope, will provide an easy framework to lean on when things get tough with mental health cases at work. So recognize something's not quite right, respond, do something about it, try and get somewhere with it, try and chat to the employee, and refer and manage. What are you going to do next? And recognize that complexity of when you might need some help. Right, let's get straight into our first case. This is Mr. A. So these cases are entirely fictional, but you will see familiar themes, I'm sure, from cases you have seen in practice. Right, Mr. A. He's a lead administrator, he's quite senior in a logistics firm. He's been off sick with stress for 2 months. Quite a long time, and stress. Case meeting with HR and manager happens, and he says, look, I don't yet feel ready to return. I've got an appointment to renew my fit note coming up. So this is a bit more context about what's happening in this case meeting. HR saying, we're worried about you. How are you doing? Mr. A says, look, I don't feel ready to return yet. HR says, have you been to see your GP? He says, yes, thank you. And I've actually got an appointment with them next week. I'm going to be renewing my fit note. HR is there thinking, look, how do I move this forward? How much can I ask here? Is the fit note always the final outcome? If he comes back with a fit note for 6 weeks, is that? Does that mean we don't speak again for 6 weeks? How do we manage that? So I'm interested to hear your thoughts at this point. What do you think the challenges in this case are? Can you spot any levers? What would you do next? So we've got this person, he's on sickness absence, he's talking about stress. We haven't been able to dig much deeper. He's got a fit note appointment. So we're already seeing some ideas about perhaps this is a challenge here that a colleague has mentioned. So feeling like we can't contact them, especially with work stress. Yes. So, is this work stress? And if it is, are we part of the problem? How do we manage that? Is there a relationship breakdown? And that's between line manager and employee. That's very insightful because, of course, Work-related stress, we know that one of the factors contributing to work-related stress is relationship breakdown at work. Someone's thinking pragmatic, levers, next steps, do a risk assessment. What a brilliant idea. Having an understanding of what the issue is. Yes, I completely echo this. Stress, what is that? Is that stress at work? Is that something else? Someone's already thinking occupational health, which is an interesting one, and I'll come back to that because that could be useful here because of the kind of dialogue that has just taken place in that case meeting with some kind of defensiveness around sharing a bit more. So really impressed that people are thinking about separating out work causes, trying to identify the core of their issues, some kind of communication cadence, asking how they would like to keep in touch. So that's useful because also we're thinking here about we've got to keep in touch, right? We've got to keep this moving. We can't just let this go. Welfare calls, that's a good idea. Someone thinking again about solutions. Can we offer counselling here? Interesting here, does this individual even know what the stress triggers are? And if it's work related, can we do something about it? Right, what's going on with the GP? Great point here. So yeah, how do I balance these needs? So I really appreciate these. I think these are all brilliant. So someone's thinking about, again, treatment. Is this person having treatment? Why don't they feel ready? What's the roadblock? Yeah, thinking about EAPs as well, impact on colleagues. This is all so on point. So I really think that you've done a lot of the work here for me, because this is where I was at after reading this. I was thinking, look, what is going on here? Do we actually know? What is happening with stress? What is this stress? Is it work stress? Is it something else? Is he getting help? What would it take to move forward here and to get him to return to work safely? Can we move the dial? And none of that really is clear from the case meeting that just happened. And you can see that that kind of Q&A that happened in the case meeting, it's hard to extract this information. This individual is holding on to it. He's a bit worried about sharing it. He's not giving us much. And these are the kind of challenges. He's saying, look, I don't feel comfortable sharing that. Don't you trust me? There's this whole thing around the fit note outcome. If he comes back with a fit note, what does that mean? Does that mean we just leave him? Does that mean we can do more? And there's also this point that people have kind of mentioned in their answers around clinical decision making and risk. So that this could be somebody who is stressed to the extent that they're having thoughts around self-harm, suicide, harm to others. We can't ignore that. We have to get to the bottom of it and manage it safely. But how we do that is difficult because we're not getting information, and that's kind of an expert decision to be made. So here's some context about what occupational health can offer here, which should be useful to you guys going forward. So occupational health gets behind the scenes. It starts to unpack the case. It can map to support, including mapping the individual to GP for liaison. Occupational health can do a clinically informed risk assessment on things like suicide risk, harm to others. And occupational health can help you move the dial, help move the situation forward. Critically, the things that occupational health offers is clinical expertise. So some of this stuff is difficult clinical decision making, and that's why occupational health teams have nurses and doctors in them. And secondly, occupational health is confidential. So I can totally understand why someone might not want to share their personal life or stresses with their manager, but they might be more comfortable doing that with a clinician. Right. So we're going to just take a look at what actually happened in this case with occupational health. So these are the things occupational health did. They got behind the scenes. They found out on speaking to this Mr. A, he's actually recently had a relationship breakdown. He's going through a divorce, leading to financial stress, leading to anxiety and low mood. He doesn't find work inherently stressful, but it's just another stress right now. It's just another thing to juggle. Occupational health unpacks further. He's been in contact with his GP. The GP knows he's been having a tough time, but he's been resistant to starting treatment. But with occupational health support, he becomes more open to thinking about CBT and starting meds. So he agrees to speak to his GP about treatment. He agrees to kind of raise some flexibility in the fit note, kind of thinking, maybe it doesn't have to be a binary not fit. Maybe I can speak to my GP about leaving some things open. We do a risk assessment with occupational health, and we find out that he's managing to look after himself just about, despite the pressure of the divorce. Fortunately, he has no thoughts of harm to himself or others, so he's not in a super high risk situation. And occupational health doesn't leave things there. We want to move the dial. So we start to plant the seed about phasing in around 3 weeks, and we book a follow-up to make sure that we touch base again. So you can see how in that case, it was really tough on the HR manager team to move forward for various reasons. And occupational health can unlock there. And that's something that might be useful to hold in mind for this case. So we're going to be meeting Mrs. B now. She is a kids activity coordinator at a leisure centre. In the last 2 months, she's felt agitated towards colleagues. People have noticed that she's been raising her voice in staff meetings. In fact, she even threw down a book during the cleanup at the end of the day. The manager thinks this is worrying, rightly so, doesn't know what to do. So what do? They go to HR for a chat. Right, let me see. So this is what happens in the meeting between HR and the manager and Miss B. HR is worried. How are you doing, Miss B? Has anything changed? Miss B says, look, I don't need to tell you all about my life. The manager says, we're worried. Have you been to see your GP? She says, excuse me, but my health is actually none of your business. The manager and HR say, are you aware that this conduct is not sustainable? If it happens again, we will have to think about our options. We can't let this kind of situation evolve at work. And she says, all right, I get it. I'm fine. I'll calm down. It won't happen again. When HR and managers are left there thinking, how do I move this forward? How much can I ask here? And how can I handle this safely and ensure no discrimination? So interested to hear from you about your thoughts at this point. Where are you at now? What do you see as the challenges in this case? Do you see any levers? Do you have any next steps in mind? I'm going to leave this open. It's a tough case, this, but you can see it happening. Yeah, let's have a look at what some of you think. So we're thinking about support is going to be very important to solve this case. I completely agree with that. People are thinking we need to speak to our colleagues. Do they know more? Does anyone have any intelligence around what's been happening to Miss B? How can we get her to open up? Does work have mental health first aiders? Can we lead on any support there? There's a really good point here about conduct may not be appropriate just yet. So that we need to figure out, is there something going on? What is the root cause? But it's very difficult to provide support without knowing the cause of her problems. I couldn't agree more. She needs lots of empathy. It's not about being nosy. We need to be reassuring that we want to help. Maybe it's helpful to put the manager in front rather than the HR in these dialogues. There needs to be some kind of longitudinal action plan. Anyone at work that she talks to, what kind of support is she open to? Reminding her of the workplace values, reviewing activities. So that's kind of thinking again, this stress route. Is there a work stress that is contributing her? So we don't usually get much detailed help. We don't get much detail from occupational health and mental prior. I don't think mentioning all the options will help escalate the situation. We need to get her to open up and be supportive. So this person's also thinking, reminding her of the policies, reminding her of the support available, thinking about occupational health or other resources, performance-based improvement plan, and we need to acknowledge that she's defensive and find out why. Yeah, so there's a lot around offering support, offering reassurance, take her out of the office for a walk and talk. I love these suggestions. This is an interesting one. Maybe she'd like to bring someone else to a meeting. When you get a management issue rather than the medical one, it doesn't help. Provide with peer support, signposter support, building trust. This is all such brilliant stuff. It really speaks to the experience in the room, because this is yet another complex situation and one that feels quite blocked currently. So I'm confident that using some of these suggestions, you could make progress here. So HR is trying to gather data, right? Trying to understand what's changed. How can we help? HR also has a real responsibility to reinforce professionalism. Ultimately, this person does work with kids, which is a higher risk role. So that has to be held in mind. Even if there is a health issue contributing, there's a real balancing act between the safety of the workplace, colleagues, and of course, clients that are vulnerable if they are kids. Here are the roadblocks. So we've got the same old roadblocks, confidentiality. This lady is really not wanting to share what's going on with her life with HR and manager. And in a way, I kind of understand that. I don't hold it against anybody. It's personal stuff, mental health and risk and all the rest of it. There's a risk assessment element. So we just said she works with kids. We've got to be really careful about how we handle this. And she's kind of dismissing it. She's like, okay, no problem. I've got it. Thanks for speaking to me. I'll get on with it now. So let's think back again to what occupational health could possibly do for us here. Occupational health can get behind the scenes, can unpack, can map to support, including GP support, can try and do a clinically informed risk assessment. And all of this is with a view to moving the dial. We don't want this situation to stay as it is, right? Something needs to change. We need to move in one direction or another to support this woman and keep the workplace safe. And how does occupational health achieve that? Well, the two key things it offers, it's clinical support. These are clinicians that can understand mental illness, their treatments, their causes, their risks, and it's confidential support. So again, an individual might feel much more comfortable having a conversation with occupational health that is kept separate from managers and HR. Managers and HR don't need to necessarily know the nitty-gritty about what's going on in this lady's personal life that's leading to all of this. They just need to know how to handle it safely at work. And that, I think, is really one of the main upsides of occupational health. So let's see what actually happened. This lady accepts an occupational health appointment, and occupational health gets going with trying to find out what's going on. So this young woman is going through a very stressful exam period. She's really worried about her future. She's feeling low, and she's been using alcohol binge drinking to cope and get to sleep. She actually enjoys work, but she finds mornings difficult. Occupational health does a bit more unpacking. Has she looked for support? She actually hasn't been to see her GP at all. Her GP is not aware. Occupational health says, this is worrying. You're binge drinking most nights. And she says, okay, I'm willing to reduce my alcohol use and I'm willing to go and speak to the local support services about this. She also agrees to speak to her college for support around the exam pressure. In terms of risk assessment, she has no active thoughts of self-harm, but she's most days consuming 10 units of alcohol in the evenings, stopping at 1 a.m. And then on some days, she attends work afterwards. So we're talking, with alcohol use, it takes roughly, back of the hand calculation, 1 hour to process and excrete a unit. So if she's stopping at 1 a.m., she's going to be potentially intoxicated when she gets to work the next day, going to work the next morning. That's kind of a red flag, right? That's worrying. So how do we move the dial here? It's worrying, obviously, for anyone to turn up to work intoxicated. That's not acceptable, but certainly in a role where she's working with kids and she's been aggressive at work, this is worrying. How do we move the dial? So we need to see her alcohol reduced to a safe level before she can work safely. We need this underlying cause to be better supported. Then we can talk about moving to later shifts as an adjustment. So reassess in 2 weeks. And in the meantime, she's going to speak to her GP, she's going to speak to her university, her college, she's going to speak to alcohol support services. We need to see progress in order to move her forward. Otherwise, she is currently not fit to work. So I'm just going to take us back to these three pillars, really. They're very simple, aren't they? These 3 steps of what to do in these challenging situations. Recognize. So you get something like this crop up on your desk in your workplace and you think, something's not quite right here. That's really all it has to be. It's almost always quite ambiguous when people are going through stressful things, when their mental health has been affected. It's never going to be a clear cut, someone saying, hi there, I have anxiety, can I have some help? We're going to be picking up odds and ends. So it's about recognizing. Once we've recognized it, we need to respond in the workplace. So have that case meeting, have that dialogue, use your line managers if there's a good relationship. Try and get what we can going in terms of finding out what's going on and offering support. But critically, if things are really uphill and the individual is finding it hard to share information about their personal life or their health, if it's feeling very complex, high risk, if you feel like you need some backup, recognize that and lean on occupational health expertise, because that's where we can really help. So yeah, this is a bit more detail on the 3-step HR mental health framework tool. Recognize something's not quite right here. That's all it has to be. Respond. Exactly as you guys have been saying in all of your answers. Let's meet, let's open the lines of communication, let's see where we get to. Maybe we can solve this ourselves if they're willing to be forward with their health information, with the support we need. If we can match that, that's brilliant. But in those situations where it's uphill, recognize the need to refer. So we need support to solve this. And that occupational health could well be a brilliant solution there. So again, leaning on occupational health mental health cases is useful. These are clinical experts, people who have trained in diagnosis, treatment, management, and can therefore really weigh into these cases and their complexities. Risk assessment. So occupational health can do this safely. It's so difficult. Hearing from you about the kind of industries that you work in, whether it be manufacturing or working with young people, risk exists and we've got to handle that safely. And thirdly, and this is kind of really important for the employee, confidential, right? So I can totally understand why you might not want to share the details of a divorce with a colleague or with a manager or with HR. That may be, as you guys have identified, the reason for the stress. Like, what is causing the stress? It often is very personal, social things going on in people's lives. And leaning on occupational health for that confidential input can be really, really helpful. A reminder on what occupational health does: it helps you get behind the scenes, helps unpack, map to support, bring in that GP liaison, help with risk assessment and move the dial, and all because it's a clinical and confidential service. What actually happens in the consultation? Well, it's simple, really. We're gathering data. We're using that data to analyze and see what's going on. Where do we need to go next? But it's always going to be a shared decision making. So the employee will always have a say. We can't force somebody to get treatment in most circumstances, and it's always going to be a shared journey around how to help move the dial, move forward. So I'm going to take us back to our learning outcomes. I think, and I hope you agree, we have covered some real sticky mental ill health situations. Again, these are fictional cases, but cases that probably resonate with you. And I really thought your input was super in terms of trying to identify the challenges, the levers, the opportunities to solve these cases. And I hope we can leave with a better idea of knowing what to do in the moment. And that this is going to be my final slide, thinking about this very simple 3-step tool: recognize, respond, refer, and manage. That's it from me. So what a whistle-stop tour. And thank you so much to all of you for your participation. I'm going to hang here and I'll see what's going on in the Q&A. We can have a quick look and see if there's anything I can do to help answer some questions. Thank you so much. It's hard work, these cases. So I'm going to just go through these one by one. Copy of presentation, yes. Our colleagues, Tim and Kat, will be emailing these, both a recording and a copy of the slides. Okay, there's some really useful questions here. This is a very interesting question. Shirley asks, how do smaller organisations manage where occupational health is not available? So that is such an important question because we know that occupational health is not available to everybody. It's not been included in the NHS offering when the NHS was first established. So what we know is that currently large employers or public sector employers tend to offer occupational health, and the smaller, medium-sized enterprises rarely have access. So I think in those situations, if I was manager or HR, I would be thinking, okay, it's not an easy one, but can we, if we're thinking, we're recognizing, we are addressing, we're referring, using that 3-step toolkit, I would think on this occasion, can we get ad hoc OH input? That would be one of my solutions there, knowing that it's not necessarily something that's easily accessible but could be brought in might be helpful. The other thing, and we've written a blog about this recently on the Insight Workplace Health website, there are many programs being offered by the government currently trying to fill this gap. So there are now government initiatives plugging gaps in occupational health provision, including in Wales. So it's worth having a look at that blog to see what's out there, because that you may be able to get some support that way to try and help your employees. This is another interesting question. So question from Avril, did you say occupational health referral can include speaking directly with someone's GP to establish facts? Yes. So that has happened to me clinically in the past, where it's very difficult to understand what's been going on with someone's health. And generally, we would need that individual's consent to approach their GP, because, of course, all of this is kind of bound by ethical principles around confidentiality. So generally, we might have a conversation like, I'm finding it really hard to figure out exactly what's going on with your health here. Would you mind me contacting your GP just to get some background? And that's the kind of thing that can take place. There are a few exceptional situations where confidentiality can be breached, generally when we're talking about risk to others, but they are a bit more nuanced. Yeah, we can ask GP for input, generally with the individual's consent. I'm just going to have a look at some other questions here. Are there any tools such as validated questionnaires which are used in managing occupational health, mental health issues? So some of your colleagues have been speaking about workplace risk assessment for stress. And that's something that occupational health would often signpost managers and HR to if work-related stress is a contributor to this mental health issue that someone's presenting with. And there is, on the Health and Safety Executive website, there is a working stress toolkit that actually takes you through those components. And that could be a useful tool for you to use in the workplace. So if someone's presenting with stress, you're finding out, is this work related? And if it is, you can then use that toolkit to really unpack the cause and address it. So I hope that's useful, Javed. So is there something specific we can write on the management referral in order to get the full background, says Claire. So this is a really interesting point. And I would say I wouldn't worry. I would lean on the confidentiality aspect as an advantage. And I almost wouldn't try and get the background, I think there's very limited circumstances where sharing that background is absolutely necessary. I think we can kind of leave that in the medical space. So we don't, in the HR space, we don't necessarily need to know that someone's getting a divorce and therefore now has depression and has been, you know, whatever the next step in that is. We kind of, all we need is to know the high level summary of this person's currently unwell. They need to see their GP, get X and Y done, and then they can get back to work once they have improved, and this is what their return to work should look like. So I would say trying to respect those boundaries can often prove more fruitful. There are situations where sharing context is helpful, but again, that's probably more for the referring manager and OH to have a chat about, like how much sharing is necessary. In general, I've seen extremely successful case management where medical confidentiality has been entirely separate and individuals don't want to share the ins and outs of their lives and mental health or physical health, and we can still make really brilliant progress. So do you contact GPs often in cases or not often with consent? I'd say in my practice, I rarely contact GPs. People tend to be very forthcoming with health information. People tend to be quite health literate. So they can tell me in great detail what's been going on with their health. There have been issues where it might be like a patient, an employee that has difficulty with understanding, and therefore they're very willing for me to contact their GP on their behalf. So that it's quite rare. I think most often we can lean on the employee's history as a brilliant starting point. Just going to see if there's any more questions. I'm going to look at the main chat now as well, just to see if there's anything interesting going on there. Okay. Someone's written here, people view OH has the potential to go on restricted work and the potential to lose their job. So OH are viewed skeptically and people don't open up. I couldn't agree more. We have a real challenge with communicating that that occupational health is a supportive mechanism, a mechanism that keeps individuals safe, that keeps the workplace safe. We are not biased toward employee or employer, but I completely understand your point, Emma, that people feel skeptical. At Insight Workplace Health, we've produced a couple of blogs and videos on this, on helping employees understand a bit more about occupational health to try and help them get the help they need where it's available. So yeah, I think that's very valid. Brilliant. So another question just popped up here. Knowing how to ask the right questions to occupational health to get the right workplace support can be difficult. Yes, that's right. We're going to be doing, I'm glad you raised that, Avril. We're going to be doing a blog on referrals and what makes a strong referral. And I think it's really, the crux of that is going to be really sharing your dilemma on the occupational health referral. So it might be saying something like, we're really worried about this person. It feels like something's not quite right. We're worried about safety. We don't know how to support them. And of course, giving them the job context, we're particularly worried because they're working with kids, or we're particularly worried because colleagues have noticed aggressive behaviour that's new, or, so that kind of detail can be enormously helpful. But we will get that blog out and I hope it will help fill some gaps. Joanna, how do we get around it when they refuse to get referred, but their absence is affecting the rest of the team? So again, I think that kind of correlates really with Emma's point about trying hard to convey the support and progress that occupational health can offer, which is not an easy communications piece. We know in the specialty that that's the case. People, as Emma said, feel skeptical. And I think the other things you can do is think about your policies and try and embed occupational health in your policies. So there's a real clear kind of status quo on how referrals should happen, and that employees are aware of it. And we've also done some, interesting to know, Joanna, that we've done some blogs on tribunals. And basically, in most of the tribunals that we're seeing, the employer is really scrutinised for making sure that occupational health has really been offered in a timely way. And I think if you're doing that on your end, sometimes that's all you can do. So really trying to get them the support they need, whether it be occupational health or any other support, and trying to say, look, what's the barrier here? Why are you hesitant to being referred? Is it an issue around feeling like occupational health is biased, or what is it? And really trying to help them troubleshoot that so they can get the help they need. Because of course, in a situation where you think you need occupational health, it's useful for you as well. It's useful for the employee, but it's also useful for the employer. I think that kind of brings us to 11:15. I cannot believe it. That went extremely quickly. Must thank you all ever so much for participating. Brilliant questions, brilliant input from all. I hope it's been useful. I hope you've left with some easy takeaways.